I wanted to create a video on clogged arteries, osteoporosis, and vitamin K2. You may have never heard of vitamin K2, but it's very different than vitamin K1. Vitamin K1 helps clot things, and even doctors, if they want to thin the blood to prevent clots, they'll give people a drug called Coumadin to thin the blood because it blocks vitamin K1. But vitamin K2 is very, 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 very different. Vitamin K2 works with vitamin D in calcium metabolism, all right? So let's just show you how this works. Vitamin D3 has a function absorbing calcium. So it actually, what it does is it allows the calcium to be absorbed by 25 times more than it normally would. So calcium doesn't just travel on its own, it needs help by other vitamins, okay? Vitamin D3 is the one that works in the intestine and helps you absorb the calcium from the intestine, much greater than if you didn't have it. And what vitamin D does is it increases the amount of calcium in the blood. Now, if you have too much vitamin D, you can end up with too much calcium in the blood. It's called hypercalcemia. But the vitamin K2 is the other part of the transportation, because without vitamin K2, you end up with plaquing, calcium plaquing in the arteries. You end up with all sorts of extra junk in the joints. Calcium on the teeth is tartar, mainly in the soft tissues. So vitamin K2 helps deliver that gunk, that calcium gunk, and the calcium that's in the blood from the help of vitamin D3 into the bone, and the teeth. So one of the purposes of vitamin K2 is to make sure you have very, very strong bones with strong calcium and other minerals, and good teeth. But what's really cool is that vitamin K2 is the most potent inhibitor of vascular calcification. You ever notice when people get older, they get stiffer and they start hunching over like this and they become almost like a stone? That's because they're deficient in vitamin K2, because calcium just kind of randomly plugs everything up. Vitamin K2 also has been shown to improve elasticity in your arteries. Now think about what that may do to your blood pressure too. It may decrease the blood pressure because it's making your arteries more elastic. There's even cardiologists now that have blogs out there recommending vitamin K2 for calcified aortic, which is like the vessel in your heart, to help reverse that. But you'll just have to do your research on that, because it also helps clean out the joints and the teeth. The other effects is that it does have effects on the jawbone and the maxillary bone and the teeth. So without K2, you end up having kind of a narrow jaw, dental problems, a need of braces, cavities, things like that. They did 3 clinical trials, and they did find that they did not see any prevention of osteoporosis by taking calcium in females, which is interesting, because I know people tell you to take your calcium to prevent osteoporosis, but that's absolutely not true, because the 3 big studies failed to show any positive relationship between taking calcium and preventing osteoporosis. And that includes taking vitamin D. And we know why, because the person is deficient in vitamin K2. They also found that a side effect from taking this calcium is you start getting calcified arteries and heart problems, even heart attacks. So by taking calcium, it can create problems, but if you know about vitamin K2, then you understand why, because they didn't have the dump truck to deliver the calcium all the way over here. Now, I did list down below what I recommend is how much dosage to take vitamin D3 and vitamin K2, because in order to make vitamin K2 work, it needs vitamin D3. So they both work together. And in nature, we always look at things as an isolated event, but really it's a complex thing that occurs. So the big question is this: where do we get vitamin K2 from our foods? Well, you get it from the conversion of K1 to K2, because K1 is in all the leafy greens. It's in the grasses. So when the cow eats the grass, it then converts it to vitamin K2. And it's in it's in milk, cheese, butter from cows that have been fed grass, not grains. It's also in goose liver. So people don't eat that. They don't eat butter. It's also in egg yolks from chickens that have eaten some grass as well. So what are the two things that people or doctors tell you to avoid for clogged arteries? Cholesterol, eggs, butter, cheese, whole milk yogurt. The exact things that have the K2 that would have prevented the problem in the first place. So, okay, so now it's another one of those everyone knows and they tell you to do this, right? But you can take it as a supplement, but you don't have to necessarily be afraid to consume butter from a grass-fed cow, or even egg yolks, organic egg yolks, or even what I like to do is I like to have the European cheeses, and because those cheeses are from cows that are on a mountain that have fed grass. They're not feeding grains, mainly from Europe. That's pretty much what I do. I consume a lot of cheese because I'm from Wisconsin, of course, but the point is that you can really help undo this and prevent osteoporosis if you get enough of the K2 and have the vitamin D3. And this is actually fascinating because it actually helps you reverse some of the aging process with the elasticity of your soft tissue, the joints, and the arteries. Okay? So this is very exciting. So I hope you enjoyed the video, and I'll see you in the next one. Hey, before you leave, I just wanted to give you a little quick history on some of the books that I wrote. This was one of the first books. It's called Dr. Berg Body Shapes. It was my attempt at writing about body types. What was very interesting about this book is I actually did all the images myself. Don't ask me why. They look actually not quite as professional as some of the images that I have in the new book. But anyway, this is my first attempt right here called Dr. Berg's Body Shape Diets. And then I wrote a book more extensive called The 7 Principles of Fat Burning. I don't even have a copy anymore, actually, because it's outdated. The next book, I put about 1,000 hours into this one right here called The New Body Type Guide. Major updates on the body types. I put a lot of energy into this. It has professional images, graphics, all sorts of things. Now, the problem with this book is it doesn't really describe what this is really about. Body types are only a small portion of what's in this book. And that's why I changed the name to the Healthy Keto Plan, okay? If you happen to have this book, you don't really need this book because there's some only very, very minor updates. But if you don't have this, you need to get this one right here. This book goes into every single detail that you would ever want to know about. It goes into the 7 principles of fat burning. It goes into hormones, the body types, the basic keto plan. It goes into intermittent fasting. I talk about the 10 fat burning triggers and blockers and fat burning strategies with a lot of details in every single chapter. I go into body issues that interfere with losing weight. There's very few people that just have a weight problem. They have a lot of body issues, whether it's sleeping problems, stress problems, inflammation, menopause. I cover that extensively in this book. Then I talk about how to get rid of stress, and I show you a technique. Then I get into exercising. And then I have a lot of really good recipes in this book as well. So this is a good reference guide. On my website, if you get this book, you get this one free. It's called Healthy Keto and Intermittent Fasting. This is the shortcut, quick guide to this book. And the reason I created this book is to have you, within 45 minutes, learn how to do keto, okay, in intermittent fasting, exactly what you need to do. Then you can fill in the blanks with this book right here. So right now I'm doing a special. If you get this book, you get this one totally free, or you can go to Amazon and get these individually. So I just want to clarify the difference between this book and this updated one right here. If you don't have this, you need to get this right here. That way you can get the exact correct information to do it healthily.